Okay. Hello, 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 everybody. We are here on In the Loop Lupus Live. We are waiting for one more guest to show up, but that's okay. We're going to start as we wait and we're going to keep on going. I want to welcome you all today to In the Loop Lupus Live. With Lupus and Color, we're talking about your lupus health, your dentistry, your dental health, and men's health with lupus on this last day of lupus awareness for the UK as well as Jamaica. So we are so excited. We have Dr. Malik Osborne and Dr. Devon Osborne who will be speaking to us each about dentistry and men's health. So we will start with Dr. Malik so that we want to be very cognizant of everyone's time and we want to make sure that everyone gets the information that is needed. And we're going to start with the dental information so that we can have some information about that. So Dr. Malik, I'm going to bring Dr. Malik up and he's going to tell you a little bit about himself and then he's going to give us a short presentation. Okay, hold one. Hey there, Dr. Malik. How are you?
Hey, I'm doing great. Nice to
Awesome.
finally meet you. Thank you for having
Awesome.
me.
It's such a pleasure to have you. We are live on YouTube. We are live on Facebook. And then I'm getting ready to go live over here on Clubhouse so they can at least hear us as well, so that everybody
Nice.
can get all of the information that you're giving us.
Right.
So,
Okay.
Dr. Malik, would you tell us a little bit about yourself?
Right. So my name is Malik Osborne. I am a dental surgeon, and ever since I've started working in the field, I've come across, it's not something that's common here, but I've come across a few lupus patients. I do have, family members. I do know of people who have lupus. And I do know that there's certain implications as regards their dental health. So, I'm really thankful for being here to be able to finally talk about it and
Absolutely.
ready to get started.
All right, awesome. You said you might have a presentation, correct?
Right. Not
Okay.
sure. Well, I did have some slides just to act as a guideline, but it's
Okay.
not
Okay, you could just go ahead and present if you like. That's fine too. We do have some
okay.
people on.
Okay, fine, no problem. So, well, just to get started, as everybody knows, lupus is basically a disease that causes inflammation of what would otherwise be healthy tissues in the body,
Right.
right? Um, uh, it's something that usually affects both men and women, but predominantly it affects women, specifically African American women and Afro Caribbean women. Um, uh, and basically, like I said, it's something that we come across on a number of occasions in a dental clinic. We come across patients who might have certain manifestations, certain oral manifestations. But I guess just as an introduction, we can talk about, what are some of the different types of lupus and, slowly dive into how it affects the oral cavity.
Right.
So as you probably know, there's a famous SLE. That's the most common form of lupus. There's cutaneous lupus that essentially affects the skin, right? It presents itself as a rash that normally is really irritated by sun exposure, right? There's drug-induced lupus, basically medication that people take that can somehow cause lupus. Like, for example, people that take anti-seizure medication,
Hmm.
certain medication for high blood pressure can also cause lupus. And then there's neonatal lupus. In other words, children that have lupus because their mother had lupus, right? Now, speaking specifically about, certain oral manifestations, inflammation is essentially public enemy number one as it relates to dental care or to the dentist and, the patient. It's something that we try and control a lot, whether it be relating to the gums, whether it be relating to the tooth in itself. So that's the awful thing about lupus. Lupus, one of the main focuses of lupus is basically causing inflammation throughout many different systems in the body, right? So we do notice that there are certain oral manifestations such as ulcers along the lip, along the roof of the mouth, along the lining of the cheek, and even though lupus doesn't necessarily directly cause dental cavities or periodontitis, gum disease, we do notice that certain symptoms of lupus tend to cause dental cavities and cause periodontitis. So one of the most common things that people complain about is actually dry mouth,
Mm.
right? Now, why is having a dry mouth, in other words, a low production of saliva important? Because the main thing that actually buffers cavities or the production of cavities is our saliva, right? It's an acid that causes the cavity and it seeps into our teeth, eventually seeping into the pulp. The saliva is very important for buffering that acid. If it is that you're not producing a lot of saliva, then you're gonna find that you have a lot more dental cavities than normal. Again, it can also be a cause for periodontitis because of the same dry mouth, because of the same inflammation that your gums are that your gum is essentially being exposed to,
Right.
right? Um, I mean, there's a wide range of treatment that we usually recommend for patients with dry mouth. One of the main ones, or excuse me, to combat the periodontal disease, one of the main ones being chlorhexidine. There are other topical gels that you can put on the sores that might come up along the lining of the cheek, along the roof of the mouth, or along the lip, to be able to combat these sores, right? But essentially, because there isn't any necessarily a cure for lupus, you essentially look towards controlling the symptoms of the disease. So
Gotcha.
you try and control periodontal disease. You try and control the ulcers or the sores that might come up,
Right. Right.
right?
It's it's it's
Mhm.
so difficult to really pinpoint how all those things come about through lupus, isn't it?
Right. Yeah, because like I said, it's still something that the health sector is learning about, as to exactly what is the cause. The most that we know so far is that it's probably a genetic, it's something that you inherit genetically. And
Hmm.
when you're finally exposed to certain environmental factors, that's when you have the lupus manifestations,
Right.
you know.
Right.
There is a famous joint actually called the temporomandibular joint that's about right here that does tend to be affected as well. Again, because of the inflammation. So people might notice that, while opening or while speaking, they might feel a lot of inflammation around that area. Again, because of the lupus. Um, there's actually a famous, what we refer to as Sjogren's
Yeah,
syndrome.
Sjogren's syndrome. Yeah. Ah,
Right,
that sucks.
precisely,
Yeah.
yeah. That causes, again, the same dry mouth. And also, if I'm not mistaken, it affects the eyes as well. So it affects the glands that produce saliva and the glands that produces tears that will come from our eyes, right? So, like I said, it really is a multi-systemic disease that affects many different areas of the body, including the teeth as well. So usually patients who have lupus, we always recommend for them to ingest a lot of water, right?
Mm.
Because of the dry mouth. We also suggest that they can use little tricks, like for example, what's it referred to as sugarless gum,
Right.
sugarless candy. I mean,
Mm.
it might sound like it's not all that or it's not that interesting, but it actually is something that can stimulate saliva production. So it's
Right.
gonna be good for basically protecting yourself against cavities. It's good because the saliva will allow you to improve your mastigation, your chewing. So it'll
Hmm.
make that process a lot easier. A lot of people don't realize that, a lot of something as simple as chewing or eating food is actually affected by your ability to mastigate properly. You understand?
Right.
And people with dry mouth, people with lupus can be really significantly affected by that.
Awesome. That's great information. I think that a lot of our listeners and a lot of the people that are tuning in have probably had some issues with, with dry mouth and the lupus sores and things of that nature. So those are very prevalent issues that we face,
Hmm.
especially with the mouth. And it seems like for me, I'm a lupus thriver. I say I'm a lupus thriver because I don't survive. I thrive every single day.
Okay.
So I know for me, I've when I look back, hindsight is 2020, and I look back at how bad my mouth was as a child,
Mm,
and how the problems were starting to actually come about then. I can actually pinpoint from my teeth, like
mm,
when things started happening almost, just as far as dry mouth with cavities and things like that. So it's definitely an important thing to do is to take care of our teeth. Very
right,
important.
right. I'm not sure if you also felt the what they refer to as a burning mouth sensation, right?
Mm-hmm.
That really and truly is more of a reference, if I'm not mistaken, towards like the ulcers, different sores that people can feel as a
Mm-hmm.
result of the lupus. But that's also a huge deal, or that's also a huge symptom that lupus patients tend to feel.
Yeah.
But I mean, I do understand. I do understand, and one of the really and truly we recommend this to all patients, not just lupus patients or not just people living with lupus.
Mm-hmm.
But basic dental care, which would be brushing, flossing, rinsing with a mouthwash, and you find that just doing that alone can really combat a lot of the oral manifestations that
Absolutely.
are associated with lupus. Like I said, the cavities, periodontal disease. So once you can control that, then it's fairly manageable.
Absolutely. Thank you for that. That is good information because you're giving us practical ways that you can
Hmm.
prevent some of these things. And unfortunately, some of the things are not going to be prevented. All of the sores might not be prevented, but you can minimize what's going
Right.
on in your body. Absolutely.
Hmm.
Absolutely. Thank you so much for that. I see that
Okay.
and Jerry has gone on, and I see Dr. Devon is ready.
Hmm.
So we're going to keep you up on the stage, and we're going to bring up Dr. Devon and Dr. Najeri. These are the Dr.
Perfect.
Osborns. I love it. I absolutely love it, love it, love it. Hello. Okay, we got some feedback. So who's got it too loud? Or
Let me leave.
Mute
move
yours.
on over to a different side of
Mute
the
yours.
room, maybe.
Mute yours, yeah. Once you mute Nigeria, that should be fine.
Dr. Devon, how are you?
I'm fine, and you?
I am so good. I'm so excited for you all to be here today. Um, it's been an exciting month, I'm sure, for and Jerry and putting out all of the information for Lupus Awareness Month, and I'm so happy that you both are here. Dr. Devon, I'm talking to you a little bit about men's health and lupus. Why don't you give us a little synopsis of what you do and who you are, and then give us some information about men's health and lupus, if you don't mind.
Okay. First of all, I'm Devon Osborne, MD, FRCS. I'm a practicing general surgeon and urologist at the Portmore Healthcare Complex in Jamaica. I'm married to a lovely wife, Dr. Karen Asher, and she has brought me these two
Love it.
lovely kids.
I love
In
it. Everybody's a doctor.
and today we will be presenting in a short while my um, what I have to say about lupus in men. Um, I would like to bring up my screen.
Okay. Do you see where
Just,
you can do that? Where it says present at the bottom, maybe?
just a minute. Injury, just a minute.
And Devon, I'm going to take you off the stage real quick and bring you back up in a few
Right.
minutes. Okay.
Okay, sure.
Now you're still on, Dr. Devon.
Okay.
Let's see. It should be a little button at the bottom that says present,
Yeah, present. Hmm.
and then share your screen
Yeah.
or slides. It says,
Mm-hmm. Share screen.
and then do you have an option to show your screen?
Just a minute. Into screen. Screen.
And thank you everybody for tuning in as we get to the screen for Dr. Osborne. We so appreciate each of you coming on and um, joining us tonight to talk about healthcare and your dental health and just men's health, because you know what? Men have lupus too. And a lot of things that we have to deal with, they deal with as well.
Hmm, just a minute. Am I
Okay.
on?
You are on.
Okay. Could you just maybe go to Malik a while I
Yeah, not a problem. You go
okay,
ahead.
go to Malik and he could fill it.
Okay.
So,
We are back with you, so go ahead.
right. So I do remember there might have been a few questions.
Yes, there
Um,
are a few questions that I do have for you, and some of them you actually touched on, but
mhm,
let's dive a little deeper into them if you don't mind.
right, no
So with,
problem.
with dental health, I know you stated that it's basic things that you can do to help with your dental
Hmm.
health as you're dealing with lupus, because we know with lupus comes the dry mouth, comes the sores, but with the
Hmm.
medications as well, like prednisone or some other biological medication or methotrexate,
Right,
medications like those can really affect our teeth. So how can we really work hard in doing the things that we need to do to keep our mouth healthy beyond lupus?
right. Well, I mean, beyond lupus, again, it goes back to the three main pillars of, just brushing,
Mm-hmm.
flossing, and using mouthwash. You
Right.
know, I did touch on the topic of the sores, the ulcers that could come up along the lining of the cheek, along the lips, along the roof of the mouth, especially. There actually is not just your basic Listerine, but there's actually mouthwash, different types of mouthwashes that are basically dedicated to managing ulcers like that, managing ulcers like those that might come up in the case of lupus patients. There are antimicrobial mouthwashes. There are mouthwashes that essentially come with painkillers, to
Mm,
soothe that burning mouth sensation. There are um, steroid creams that you can essentially put on top of those sores to basically combat those effects of the ulcers that
right.
accompany lupus. You know.
And you know what I found, at least for me, I had a CBD cream that I
Hmm.
use for joint
Okay.
pain and for cuts and things like that. And it
Right.
actually works on the sores that come on that might come on my mouth or might come,
Hmm.
outside of the mouth or whatever have you. Because we
Hmm.
also get the sores in the nose and things of that nature. So there are so many different ways that we can keep those three pillars
Right.
really intact.
Right. Unfortunately, there's still so many places where people don't necessarily have access to CBD. People don't necessarily have access to CBD research, are able to carry out research regarding the different advantages of how CBD could be able to improve joint pain in patients with lupus. So
Right.
unfortunately, that is still an area that's lacking. For example, I am here in Brazil actually, and you don't find much information about that. But
Mm,
I mean, there are different avenues that can be explored. Like I said, beyond just the typical mouthwashes, beyond just the typical dental care that I usually propose, which is brushing, flossing, mouthwash. There are different remedies that can be used to cure, for example, the joint pain associated with it. I'm actually I'm surprised that CBD isn't actually used more often amongst a lot
right.
of patients, but obviously there's a certain stigma that needs to be gotten over. But as far as I know, up to now, those
Hmm.
are the basic types of care that basically we can do to control those different symptoms. You know.
Absolutely. Absolutely. Very good. Very good. Another question that people have is, you said you have there are different I guess it's medicated mouthwashes that can keep
Hmm.
the sores down. Are there
Right.
also mouthwashes for dry mouth that can help that, that you don't have to have prescribed and things of that nature?
I'm not so familiar with mouthwash that would be used for dry mouth that wouldn't need a prescription, at least where I am. You
Okay.
understand? But I said, there is the case of chlorhexidine, which is basically a type of mouthwash. It's not necessarily used for dry mouth, but it is used for more the periodontal effects of
Gotcha.
lupus. Periodontitis being the inflammation of the gums, essentially. Chlorhexidine will find that it really does help to bring down the population of bacteria that
Mm,
eventually causes periodontitis and eventually causes bone loss in the mouth.
right, right.
So chlorhexidine is a major thing that we always prescribe for our lupus patients.
Wow. Because I guess lupus patients, and any doctor could really, attest to this, that a lot of times, because it mimics so many different things, we would
Hmm.
use something off brand to treat the things that we're going through.
To be able to treat the symptoms right. Exactly.
Yeah,
Exactly.
absolutely.
So, I mean, there really is a lot to be done as far as dental care and lupus patients because I think not a lot of dentists actually have that much experience, first of all, diagnosing that, hey, this also might be a sign of lupus. You know, not a lot of dentists necessarily have experience with treating lupus patients, understanding that, hey, you know, these cavities that this person is presenting or periodontitis that this person is presenting isn't necessarily because of bad oral hygiene but more so because of the presence of lupus.
Right, right. That's
You know.
interesting. That's interesting because I think you're right about that. In any country that you're in, I don't think
Hmm.
many people have much information about lupus in general anyway. And then to go in detail for, dental health and things of that nature, as far as the sores, as far as the inflammation of the gums and everything, I think you're absolutely right. I think you're absolutely right with that. Thank you for that.
Precisely.
Let's see
Precisely.
if Dr. Devon is ready.
Okay.
And I see a right here.
Are you
Okay, how we doing here?
are you seeing my screen?
I do see your screen, lupus in men.
Yep, that's it.
Awesome. So now all we got to do is click along, right? Let me see if I
Yep.
can. I think
Yep.
everybody should be able to see that. So, Dr. Osborne,
Yes.
you told
Mhm.
us exactly what you did. So, tell us about
Mhm.
lupus in men and how it affects men, because I think a lot of times our men get left to the side. And that's unfortunate because they're at least 10% of the people who get lupus.
Yes,
And
and
it's something that needs to be discussed.
that is true. In fact, lupus, first of all, systemic lupus erythematosus is a multisystemic autoimmune disease. And this is characterized by by the body's own antibodies. They are actually attacking normal tissue. And so, because of the ability of these antibodies to attack the normal tissue, you find that it is a systemic disease which will actually attack most of the organs in the body. Usually, there's a prevalence or a tendency to attack certain more than others. It is characterized by episodes of exacerbation and remission. And by that, we mean you will have times when you have the disease flaring, and then there are times when there's remission, you're fairly well, you have very few symptoms or no symptoms at all. And
Right.
so you have a time when the lupus almost is non existent. But
Mm-hmm.
the antibodies are still present, only to reoccur at another time where there's more exacerbation of the disease. As a
Okay.
result, as a result, the, there is continued destruction of the different tissues. And
Okay.
so you'll find that in the case of the kidney, you can have, it can go on to renal failure. You usually have nephritis, inflammation of the renal tissues, and then this will continue until the both kidneys have gone to the point where they are no longer able to carry out their function, and so we have um, renal failure. Lupus
Absolutely.
in men tends to be much more severe. And the reason, apart from the fact that we are not quite sure why this is so, we believe that the diagnosis of lupus usually occurs at a later stage. And because of this, the disease or would have progressed to a point where the manifestations are more severe because it has gotten a longer time to carry out its deleterious effect and causes and we our organ failure or organ destruction
Mhm.
occurs at a much later time.
Right.
Um, Lupus is not only more prevalent in men, but it is also more prevalent in blacks,
Mm.
Hispanics, Arabs, Native Americans, much
Mhm.
more so than their white male counterparts. And so we find that here in Jamaica, although it is not very prevalent, we'll find that it is still more prevalent than you would see in the United States and other um, North American or predominantly Caucasian countries.
Right. Okay. That's interesting. I wish I was a scientist so I can figure out why that is. Besides the fact of biases and racism and things of that nature in the medical field that can happen,
Mhm.
I wish that I was a scientist so I can really figure out why is that something that we're getting struck with more than any other racial uh, person.
Well, I believe that there are certain diseases that occur, and it could be because of a natural selection. For example, we have certain advantages in malaria, for example, just to digress a bit,
Hmm.
in that over many generations,
Right.
etc., we have
Okay.
a natural selection to be more resistant to malaria. But
Hmm.
it's a sickle cell hemoglobin that is much more resistant to malaria. And so, by natural selection, after a period of time, we are less likely to have malaria, but we are more likely to have sickle cell. I don't know if this is a cause, but I suspect that in many such diseases where you have maybe the genetic factor, but environmental factor playing a much more significant role over many generations, you do have this sort of prevalence of diseases among one race more than
Hmm.
another. So
Absolutely.
that might be the cause. So
Absolutely.
the symptoms and signs of lupus in men are many, quite similar to those of women, but we do find that, for example, you do have a higher prevalence of kidney associated symptoms and signs and symptoms in men than in women. Um, we do have very similar symptom presentation both in the men and women as insofar as the disease is concerned. You do find, for example, that there is usually, if we take it by systems, we do have in the cardiovascular system patients tending to have more cardiac diseases. You do have um, cardiac failure, etc. If the disease is caught at a later date or when it has gone to the point where it has significantly impacted on the heart's ability to carry out its function. You have complications occurring in the blood vessels. You also have, for example, clinical cutaneous manifestations, which we are all familiar with. That is the butterfly sign that occurs in the facial presentation of the disease. You have joint where there's an attack on the joint surfaces and the joint lining, causing inflammation of the joint and the usual arthritis that is associated oftentimes with systemic lupus. Renal disease is also quite prevalent amongst men. As I said before, it is usually the format in which men not only present with lupus, unfortunately, but by the time the diagnosis is made, it is often a time when the disease has gotten to the point where renal function is so affected that you have to go on to have like dialysis, etc. Serositis, inflammation of the serous membranes, as I had mentioned before. A characteristic of systemic lupus is chest pain. And this chest pain is often because of the inflammation of the tissues that occur in the chest, and you have the inflammation as a result and the associated pain. As we mentioned before, the rash, chest pain, extreme fatigue is also one of the presentations of lupus. Many times, persons go to their doctor, men go to their doctor complaining of fatigue, loss of interest, in some cases, libido as well. They might have hair loss, joint pains, and because the misconception that lupus does not occur in men, us as doctors, we tend to look for other causes of these manifestations until we finally come up on the diagnosis. As I said, by that time, it may have caused significant organ compromise throughout the patient's body. Sensitivity to fluorescent light. We all know that patients with systemic lupus, they are sensitive to light, and they should take special care as part of the coping mechanism when the disease, the diagnosis is made. Swelling around the eye, hands, these are all presentations of lupus that our medical community, we have to be aware of, so that the disease does not go undiagnosed for any significant period of time. The investigations of lupus is usually, there is no single test that is going to tell us that a patient has lupus. And in fact, the American Rheumatological Association, they have a symptom score, or where, depending on the number of positive signs or symptoms that you have, the diagnosis of lupus should be entertained. In terms of our laboratory tests, blood, we usually, as routine, do blood and urine tests. In the blood, you might find you have the significant elevation of the particular test known as the erythrosedimentation rate, which might be significantly elevated. Anemia is also a frequent cause or a frequent presentation with patients with lupus. And again, although it is not indicative of lupus, men with significant erythrosedimentation rate, hemoglobin, low hemoglobin, fatigue, etc., these are then the possibility of lupus should be entertained. Imaging tests. We'll often do chest x-ray because of the pain that might be associated. But again, there's no significant finding in this modality that will let us know that the patient has lupus. Echocardiogram, again, if there are significant changes in the heart, if the heart is significantly affected, you can have echocardiographic changes, which will suggest lupus. Biopsy is a modality which we use especially in persons with the cutaneous presentation of the disease. The kidney biopsy, although reserved, but oftentimes this is what we will have to resort to at times to determine if the person, or will give us an idea if the person has lupus. Treatment. Because of lupus being an autoimmune disease, the treatment is often tapered according to the symptoms, signs, exacerbation, and remission of the disease. So when the patient is having pain, etc., we usually try to use a non-steroidal anti-inflammatory drug before we go to the more powerful corticosteroids, prednisones, etc. Antimalarial drug has also been part of the treatment armamentarium of systemic lupus, but this is usually occurs during the time of exacerbation of the disease. Immunosuppressants, of course, we know we'll use immunosuppressant when there is significant manifestations during periods of exacerbation. But again, because of the potential side effects of these more powerful drugs, we usually keep them in reserve so that we will have those to use if there is progression of the disease and the less toxic medications are not helping.
Right.
Alternative medicine, we do have persons who will use alternative medicine, and I am someone who usually advocate that the patient should use not only traditional medicine, but if they are comfortable with it, the use of alternative medicine, I do not discourage,
Right.
because we don't know everything as
Mhm.
physicians, and
Right.
oftentimes psychologically and oftentimes biologically, these alternative medicines do help in the treatment of lupus. Fish oil is also used. Acupuncture, I'm not familiar with the use of acupuncture, but in the literature they do refer to the use of acupuncture, no doubt maybe for the painful episodes, etc., that the patient with lupus can have.
Awesome.
I believe, however, that the importance of lifestyle adjustment should
Mm.
be key, should play a key role and should be the key factor in patients who are and men who are diagnosed with lupus. I,
Good
I
point.
am happy to see to hear you refer to yourself as a lupus thriver and not and
Absolutely.
because it is this sort of positive approach to the disease which will make your life your life not only better but reduce your risk the risk of having end organ diseases, end organ failure as a result of lupus. So you
Right.
should see your doctor regularly. As we said before, it is a photosensitive disease, so you should be very sun smart. Exercise is very important, not only because you will help to keep those organs going, but you will find that, like your joints, which will tend to, because of the pain associated with it and the inflammation, by exercising, you will maintain your joint mobility and reduce the long term effect of joint lupus. You should eat healthy, emphasizing fruits, vegetables, as I have on the screen there, reducing those complex carbohydrates and proteins, which can they themselves do stir up immune response um, for the patient. And as such, you have to be careful with that. You should always ask your doctor for the need of vitamin C, vitamin D, and calcium supplements, which will help in the maintenance and restoration and maintenance of your bone integrity. So, in conclusion, is lupus more severe in men than in women than it is in women? Research has suggested that lupus experience a more severe form from the disease, which we know from our practical experience. However, if our health personnel are aware of the possibility of lupus and our patients themselves with the various symptoms do research, then we will find that the severity of the disease will get less when we are more educated as men as to the possibility and as physicians that this might occur, and we can start treatment early. What are the disparities in lupus diagnosis and treatment among men in comparison to women? Again, because of the false assumption that it does not occur in men, we then end up treating disease at a later stage. And as such, we find that it is more difficult for us to treat men with lupus.
Mm.
More research is definitely necessary as to why the disease is more, why it is more prevalent in women, and also is there some other factor than the ones that I've pointed out before that could cause a disease to present in a more severe manner amongst women, amongst men rather.
I wonder sometimes, just to break in real quick with that, would hormones play a major role? I know I've read several, articles and talked to several doctors that said that maybe hormones might play a role for it to happen more in women. I'm not sure how that happens. How do you feel about that?
We are not sure, but if the milieu of hormones that occur in men and women, you do find, of course, that the estrogen and estrogen-based hormones occur significant. It's much higher in women than in men, and so we believe research seems to be tending to err towards the higher level of estrogen amongst women than men as maybe one of the facilitating factor for the production of lupus. But again, no, there's been no conclusive research produced that shows that the estrogen is a causative factor. But we do believe that that might certainly play an influential role.
Absolutely, absolutely. Thank you so much for all of your information. It's important for us to really talk about, especially the disparities that you were talking about, the assumptions that men don't get it, and the weight that men have to have before they're even believed. How do you find that sometimes with men, do you find that sometimes there's some medical gaslighting with that, or is that something that you're not seeing day to day?
Lupus is not frequently diagnosed, certainly amongst the population of men that I see. Being a urologist and general surgeon, it is usually something that you'll see more frequently among, well, certainly the internists and the dermatologists and the nephrologists will see. I am associated with a dialysis unit, and indeed, some of our male patients, not many, lupus seems to be the cause of their renal failure. Why we do not have, I do not know if it is that it is going undetected in Jamaica or
Hmm.
in our population, why we have so few diagnoses of men with lupus. I'm not sure, but that this seems to be the case here. An
Yeah.
underdiagnosis of the disease, that is because of the lack of awareness that the lupus does occur in men, and it needs to be treated aggressively.
Right. I know here in the United States, a lot of the problem, some of the problem, I won't say a lot of the problem because I don't know a lot of everybody, but
Hmm.
some of the problem might be what I find here in the United States is that they are kind of embarrassed that they're not feeling well and they're not really sharing how they're feeling. So by the time it gets to a point where it's unmanageable,
Hmm.
then they're able, then they don't have a choice. They have to go to the doctor. And then that's when everything is put in place like, oh my goodness, you have lupus, you have all this inflammation, your markers are high, this, that, the other.
Yeah, I believe also it is the way of the the species or the male in the male of the species. By and large, not only for lupus, but most other illnesses, men do exhort and urge their women folks to seek medical attention early, that they should take their kids to the doctor early, but they themselves never go. And
Yeah.
so most diseases, unless we have good, strong public information,
Hmm.
so that persons are aware of the disease, then we will continue to have this 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 problem where men are usually going to the doctor when it is much further down the road or it is already too late.
Absolutely. No, I think the most important, I just typed it in the chat as well, is that strong public information is so important. That was such an important point because I think that we lack that often everywhere, especially for these known diseases that no one knows about.
Yeah. Mhm. I'll tell you, just as I'm digressing a bit, and as I said, coming more to my specialty. I find that, for example, prostate and prostate cancer, there was initially a huge resistance, for example, to men going to the doctor because they feared the rectal examination. And so when I give talks, I always preface it by saying, I'm not talking to the men, I talk to the women,
Right.
because it's the women who will urge and see to it that the men go to the doctor to have their checkups and to check their prostate. And so public education is very important. Targeted public education perhaps is even more important, especially in developing countries as ours, where there might be some limitation insofar as the ability or the funding of public education is possible.
Awesome. Awesome. You've given us so much great information. All of you, both of you guys have given us so much information. Let me bring everyone up so we can start to have just a small discussion. Let me get Jerry up. All right, we are all here. Can everyone hear me?
Loud and clear.
Okay, awesome. And Jerry, can you remove yourself from the mute button, please? So I will mute Dr. Osborne, Dr. Devon. Hold on, and then we can get you. Come back on, Dr. Najeri. Okay, that's a little bit better for now. But I wanted to thank you, Dr. Najeri. Can you introduce yourself and tell us exactly what you do?
Sure. First of all, thank you so much for sharing your platform with us, Raquel. It's just been an honor. It's always an honor to present with you. And I'm so proud of, both my brother and my father, for the interest that they took in the topic, because of my nudging, because of their own experiences with patients. And I think these types of discussion, albeit small, they're so important, as we were discussing earlier, in public awareness, creating public awareness, and educating our population. While lupus is a rare disease that occurs in men, you know, it we've had somebody in the public eye, a very popular persona. It is said that he had lupus. That's was his cause of death. So it's there. It's prevalent, not prevalent, so to speak, but it's here, but it's not talked about enough. And I
That's
think, and I love that you've taken the helm in just, educating not only people in your community, but the world through social media. I think it's wonderful. I've been participating in the Walktober, the Lupus
yes, I love it.
and I must tell you, Raquel, it has been wonderful, very fulfilling in to do, and it certainly does. It's a great way to start off my days. It has been a great way to start off my days.
Awesome. Awesome.
So yes, I'm a general practitioner in Jamaica, and I work with the Lupus Foundation of Jamaica. I and often we will have activities that helps to bring out our community. The other day we had a 5K. We had a symposium that was very, very informative. And, I love that you and I were able to, share that with your community at the end of the symposium.
It
So
was it was it was an awesome symposium. I so thoroughly enjoyed it. My husband was sitting there with me, was like, "Wait a minute, I didn't know that."
nice.
So it was very awesome. I so appreciate you always sharing that stuff with me.
Thank you. I've been reading literature recently. I don't know if you've seen, but they've made strides in terms of treatments of lupus recently, in terms of a possible cure.
Hmm.
I was shown a headline. I read an article recently discussing that. So and also I've been reading more about the impact of gut health on
Mm.
causing autoimmune diseases to manifest themselves. So I'd love to, kind of introduce that into the conversation. We
Absolutely.
mentioned, alternative medicine, the impact of eating healthier lifestyle and diet. And I think that impacts so much with gut health that, again, we believe could be a precursor for the onset of autoimmune diseases such as lupus, such as Crohn's disease, which is an autoimmune disease of the gut as well.
Absolutely. I think that's an important point, especially since I'm a big proponent of keeping journals so that you know how things affect you, and you know how your food affects you, and you know how your mood affects you. You know how, like we were talking to Dr. Malik, how what toothpaste affects you, and and just trying to find different ways. I think that if we could eat nails and get rid of lupus, we all would do that. I'd have a handful of them and shoving them in my mouth. No matter how many cuts I would get, I would just eat them. But it's so interesting because I think that a lot of people who have lupus might get a little taken back when you say, oh, you need to think about your gut health. But it's a very important part of what happens with your symptoms and how lupus came about. You know what I mean? So
Right.
I appreciate you interjecting that into the conversation because it's important. We have to really understand what we're eating and how it's affecting our body and how we can clean those areas, the colon and all of those things to make sure that we are as healthy as we can be with lupus.
Absolutely.
Until a cure is found, correct?
Right. Until a cure is found.
You know, so I want to thank you. I want to thank you for contacting me and asking me to do this. I so appreciate the Dr. Osborne's. Y'all are amazing. Y'all are
Thank you,
amazing.
Raquel. Thank you.
Amazing. I so appreciate all of your information. I don't see any questions here on the chat, and I don't see questions. We've been doing this on Clubhouse, which is something new for me, guys.
That's all
So
right.
I'm not
Yeah.
sure if it really went through. If it did, awesome. If not, that's all right. We'll put it back up there later. But I do want to ask you guys, what what prompted you all to really work in the medical field, and what prompted you to get out there to help your fellow man and to help talk about lupus and other issues that might occur? I'll start with Dr. Jerry.
Sure. It was grappling with the information uh, that I read in textbooks in medical school. For me, it was how do I translate what I've learned to educating, to breaking it down, the literature, and educating my patients. So I believe it's that passion, that bridge in reading scientific literature as well as communicating that to the public that I just gained a passion for. When I read about lupus, I've mentioned this to you before, but that's all right. When I read about lupus, I was drawn to it because it affects predominantly African American women and Afro Caribbean women, right? And in diving deeper into the disease, I realized that it is multi-system. It affects all disease, all organs, right? And in reading more about the disease, interestingly, I was able to learn more about the organ systems in the body as a whole. My teacher loved to say that if there's some diseases such as diabetes, right? Uh, Cardiac diseases that will allow you to learn about the rest of the body and treatment. So I latched on to lupus, and my medical education has benefited tremendously because of that drive to learn more about lupus.
Absolutely. Awesome. Thank you. Dr. Devon, how about you? Take yourself off mute.
Still learning
There
the
you go.
technology.
You gotta love it, right?
Yes. I think that certainly from a tender age, my mother especially always said she wanted um, to have a doctor in the family. And although initially I really did not have much interest in it, eventually it sparked my interest, and then I got the opportunity. I got a scholarship to go to Cuba to study medicine, and it was a fantastic experience. And I believe that because of the way medicine is taught there, where it is taught preventative and you should care for your individual, etc., that really encouraged me to continue to do medicine in that caring way for the individuals. I've also always said to my patients, I have a fantastic profession. It's something that I love so much that I would do it without getting paid.
Oh,
Fortunately, I'm paid for it.
I'm glad you are.
So so I've always since then my passion for medicine, for caring for persons, it has not faltered. And I have encouraged my kids to join it, and I'm glad that they have. And so
Absolutely.
that's where we I think they have benefited from the my exposure. And I think they will certainly benefit from my experience in the medical field.
Awesome. Awesome. I love it. I love how you and your wife, you all have just created this whole family of medical a medical team that is so caring and so empathetic, and it's very important. Thank you so much for that. Dr. Malik, how about you?
Right. How did I?
You
Can you
went the
repeat the
other way.
question?
You went to the mouth.
Well, no. To be really honest, my earliest, um, I guess, source of inspiration was actually when I was running a road race, actually, with my father. And I remember the road race was actually in the city where he works. I was running side by side with him, and literally with almost every step, I remember somebody was saying, "Hey, Dr. Osborne, hey, Dr. Osborne." And up until then, I didn't really know that, Dr. Osborne, my father, Devon, was so popular, not only in in the immediate community where the clinic is, but just in the whole entire city, because it was a really long road race. So that was definitely a really impactful moment for me, because I just realized how much, how far-reaching care, especially medical care, can be. How good it can be just to take care of people, and how much they repay you just for these little small gestures, just by recognizing who you are, and stuff like that. But I mean, obviously, even from before that, just knowing that my father and my mother were persons who practice in the medical field, that was always a source of inspiration. And just growing up and just enjoying, seeing people's faces, after they've been treated, after you give them a positive, outcome in the procedure that they came to you for. It's just a really nice feeling, and just something that's much more simple. You take something like the common cold, for example. I personally, I hate whenever I have the cold. I hate whenever I have the flu. And it's really in those moments that really show me that health really and truly just the utmost. Without health, without feeling well, you can't really do anything at all. You can't enjoy anything. You can't, take part in anything that life might have to offer. So it was those little small sources of inspiration that just pushed me and just kept me going, in the medical direction.
That is
So,
awesome.
yeah,
I
man,
mean, it was such a seed planted. Dr. Devon, you
definitely.
just you planted that seed, and this is what you reap. It's amazing. It's amazing. Because it's so important. Living in the U.S., it's hard to find doctors that are empathetic.
Mm,
It's hard to find doctors that are there for preventive. You know what I mean? So
Mhm.
as I'm listening to you all speak, I'm so appreciative of what you have sowed into your children and what was sowed into you to continue to help others just be well Not even just beyond lupus, but just to be well in general, and that's important. Thank you so much, everybody. I so appreciate it.
Definitely.
I
Um,
have one last question because I want to be respectful of your time, and I think my last question is, um, if you could give one piece of advice to anyone with lupus, what would it be? I will start with the lady of the hour right now, Dr. Najeri.
Oh, Raquel, what I would say. So, in one of the videos that was featured on your platform recently about lupus warriors in Jamaica, we interviewed a woman who said that, at that moment that we were interviewing her, she was having a lupus flare,
Yeah,
you
I
know,
heard.
and I remember being taken aback by how casually she was mentioning it, but the fact that she was just out and about, helping where she could, helping the Lupus Foundation of Jamaica where she could as a volunteer, and also, even impacting me with her words because she said that with lupus is just a heightened sense of healthcare, taking care of your body, right? That is something that we all need to implement in our lives, and I really appreciate her for mentioning that because health is not necessarily is not just a state of being, but rather an activity, a verb. Maybe we just need to, certainly implement activities such as Walktober, you know, such as the basic oral health care that my brother mentioned earlier, and such as seeing your doctors, importance of seeing your doctor, and recognizing when you're just not feeling well, as my father had mentioned earlier.
Absolutely. Absolutely. Thank you for that. I think what I just took from what you said is health is a verb. It's an action that you have to take control of every single day. Whether you have lupus or whether you don't have lupus.
Right.
It's actions that you have to take place. Awesome. Awesome. Thank you so much for that. Dr. Devon, how about you?
the best single advice that I would give to a patient who has been diagnosed with lupus is this is just a junction in your life's journey. It is not the end of the journey. It
Mm,
is just a crossroads where you will have to continue to live because giving up is not an option. And indeed, you should continue and make the most of it because with it, there are a lot of benefits. If you can so look and find it and make yourself an even better person.
awesome. Woo. Just a junction in your life journey. I love it.
Yeah,
I mean, you all are just like so on point with everything that I put in my mind, everything that I walk with daily. So that is very important to understand that this is just a little hump that you need to get over. It's not
that's
the end.
that's
Absolutely. Thank you so much for that. Thank you so much. Dr. Malik, how about you, darling?
If I was to give one bit of advice to somebody who was recently diagnosed with lupus, one of the pieces of advice that I give is actually something that Njiri had mentioned earlier, which is gut health.
Mm,
And more importantly, I guess nutrition, because I don't think we really understand how much our diet, can contribute to our overall health. It's literally something that we do every day, which is eating, ingesting food. We eat at least, well, it's supposed to be 3 times a day. So that's the main hint that I would give you, nutrition. There are no foods that cause lupus, or there are no foods that can cure lupus. But
right.
obviously, having a certain standard of nutrition can definitely help with that. Just really improving on your diet. From what I understand, consuming stuff like fatty fish, nuts, oils, um, basically foods that are rich in certain vitamins, can really help with offsetting the symptoms of lupus and improving overall health. So that's definitely something that I'd recommend.
Definitely, definitely. It all goes back to that lifestyle change that your
Mhm.
father was talking about, how that is so important to change
Right.
that lifestyle. And the things that we're used to eating and used to consuming, they might feel good when they go in, but in the body is creating different symptoms in you. You know what I mean?
Yeah,
It's just the reality, we love all that sugar, we love all this,
yeah, and
it's
it's
this
not
and that,
healthy.
but the reality is that it's really harming our bodies more than it's helping us. So we need
Yes.
to find those ways to get around that and do the right thing for our bodies. And that was part of what Walktober was for, and
Mhm.
why
Mm.
we do that every single year, just to teach people the importance of moving and getting out of the comfort of the pain. Even though it's a discomfort, there's still some comfort in laying in that pain, and we want to change that narrative in their head. I know I said that was my
Certainly.
last question, but you know what? This is a family affair, and I actually have my brother is on, who which
Nice.
is so funny. It's such a family affair. I love this whole family thing, and he probably tuned in just a little bit late. His name is Brian. He's under here as Be Ready Today, but his
Hmm.
actual
Hi, Brian.
question. I know, right? Question was, what are the concrete symptoms of lupus in men? And I know, Dr. Devon, you uh, spelled those out a little bit earlier, but could you give us just three things that men need to start looking at that might show
Well,
that it might be some type of inflammation or some type of lupus going on?
certainly, if you should be fatigued and unexplained fatigue, obviously, the obvious signs, the butterfly, cutaneous lesions to the face, those are usually telltale signs. But the more subtle signs like fatigue, anemia, loss of energy, loss of libido, these are things that should be looked at. And you should go to your doctor for him to do the necessary investigations as to why are you having these um, inexplicable symptoms and signs.
Absolutely. Thank you for that. I appreciate you doing that. Um, my brother is such a great inspiration to me. Like, just like you all have y'all inspirations in your family, my brother's one of those that he's gonna make sure that I'm okay. So I appreciate you answering that question.
We appreciate that he does too, because you are doing a fantastic job.
Oh, thank you so much. I'm so happy that we were able to link up today for this last day of Lupus Awareness Month in the UK and Jamaica. I'm always
Hmm.
reminded, and Jerry always comes to me, and she's such a breath of fresh air for me. And I loved when she asked me to do something. I'm like, "Yep, let's go. I'm on it." She doesn't even have to ask anymore. She just knows that she can count on me to get the information out there that she wants to be put out there, and I appreciate her so much. So I so appreciate you all tuning in today, and I appreciate you all giving us your information. Is there anything else that you all want to say before we decide to let you go about your day and have your dinner or whatever have you, and have the rest of the time with your family?
Sure. Raquel, I just, like to thank you again for, entertaining the crazy ideas. But, what was your main inspiration behind, creating Lupus in Color, and what drives you?
That's a good question. Well, as you know, I do have lupus. I've had lupus for over 20 years. And when I was diagnosed with lupus, I had just moved from a big city to a smaller city. And when I was diagnosed, I didn't see anybody like me. And let's be real, it affects African American women most. And when I was diagnosed, I didn't see anybody like me. Everybody that I saw was Caucasian or older than I was. And that put a fire in me. And I always say, out of necessity comes creativity.
Mhm.
And out of that necessity of seeing someone like myself, I created Lupus in Color. And I created it because I did not want anyone else to feel as lost as I felt when I was diagnosed. I felt like there was nobody out there to understand me. I felt like there was nobody out there that understood anything about Black healthcare or anything that I was going through. So I created Lupus in Color so that I could educate, inspire, encourage, and empower people all around the world. And what drives me is my own fight, my own fight. Every day I fight for my life. And I'm happy to do that because, okay, that's my cross that I'm bearing. And with that cross, I'm just going to put it on my back and I'm going to jump up and I'm going to move with it and help someone else carry theirs. And it's just become such a passion of mine, to just help people and help them understand their own bodies, help them understand the importance of creating a lifestyle that's healthiest for them. And it's just growing to something that is very, very, very humbling for me. So I appreciate that question. I appreciate that. Yes, definitely. I want to thank everyone for tuning in today. I so appreciate each and every one of you who support Lupus in Color. This particular presentation was put on by Lupus in Color, of course, and in Energy Productions, which is Dr. Najiri. So I so appreciate you all. If there is nothing else, I'm going to let you all get back to your day.
Okay, thanks for having us.
And I so appreciate
Thank
each
you
and
so
every
much.
one of you. I look forward to doing this again very soon.
We hope you will.
Most definitely.
Oh, thank you so
Thanks
much,
a lot.
everybody. I appreciate you. Thank you, everybody. And I so appreciate everybody who has tuned in, who has asked a question, who has talked about what Lupus in Color is doing. I appreciate each and every one of you. Thank you for tuning in. I hope that you all will go and share this so that someone else can know what lupus is about and how important it is to take care of your dental health and to learn about men's health with lupus. So thank you, everybody. I so appreciate you tuning in. We'll see you next time. Bye bye.